I'm Mary Jones. I serve as chair of the Marriage and Family Therapy Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask members of the advisory committee to respond to a roll call to signify their presence in this open meeting that's being held remotely by conference call and other electronic medium. Jim Kilmartin,
Good morning.
Nicole Eitzen,
Good morning here.
Chris Haben,
Here.
Betsy Henderson,
Here.
Marcy Lichtenberg,
Here.
Diane Siebel.
Here.
And I note that the following BSRB staff members are also present: David Fye.
Here.
And no Emma today?
No, she'll be doing the minutes, I think, afterwards, but not
Okay.
here today. So.
Okay, great. Next, David Fye will be reading a statement about this meeting being held remotely.
All right. Thank you, Mary. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or by watching the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. As such, we will be conducting this meeting pursuant to the KOMA. On October 14th, 2024, we sent notice to the advisory committee meeting to all individuals who had requested notice of such meeting. The notice is also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using a link to the meeting on the agenda. And before we got started, Mary, I did check the conference call line. No one is on the line, but if I hear someone beep over and announce themselves, I will let you know.
Okay, thank you very much. The first item of business is our agenda approval. Are there any comments, thoughts, suggestions, or changes to the agenda? If not, I'll take a motion to approve.
So moved.
Thank you. Second?
Second.
Thank you. Marcy, all those in favor, please signal by saying aye.
Aye.
Aye. Any opposed, same sign. Fantastic. The next item of business is reviewing the minutes from our meeting on October 11th. If there aren't any comments, changes, or suggestions, I'll also take a motion to approve those.
So moved.
Thank you,
Second.
Betsy. Thank you, Jim. That was Jim, right?
Yeah.
Okay, all those in favor, please say aye.
Aye.
Any opposed, same sign. Great, thank you. Dave, I'll move to you for the executive director's report.
All right, thanks, Mary. First, a couple notes about BSRB operations. The last few months, we have been working with a company called CE Broker. That is a group that the board has agreed to work with to provide a benefit to licensees. So when you are licensed under the BSRB with a permanent license, you have a requirement to undertake a certain amount of continuing education hours. And when you renew your license, if you are selected for audit, you will need to demonstrate completion of the hours by providing that documentation. Well, what CE Broker does is it provides a service to similar licensing boards to the BSRB. It provides a platform for licensees to be able to upload that documentation when they complete the hours they need. And so if you are selected for audit, rather than the traditional method of us requesting records back and forth, reviewing those, the portal that CE Broker provides allows you to upload your documentation, assign those hours in specific categories too, like ethics or diagnosis and treatment. And then if you are pulled for audit, we can check the portal. And if you have those already uploaded, we can approve your audit and it goes by really seamlessly. So this is a relatively new arrangement that we've been working with CE Broker. We have started to roll out the different professions for the BSRB. We started with the first two, I want to say about 2 or 3 months ago. And then about a month and a half ago, we opened it up to 2 more professions, and the remaining 3 professions we will be opening up probably at the end of the year. So, so far we've had a lot of positive feedback from this. I do think licensees are warming up to the process. It is not a requirement. We did want to make sure that this would be something that would be optional for licensees, but we do encourage them to take advantage of it because there is a nice benefit rather than holding on to your record, not knowing whether you'll be audited or not. This provides a nice place for them. And for the BSRB, once a lot of licensees start taking advantage of this process, it'll make our auditing process more timely and more efficient as well. So a win-win. The way the company does make money is they have some optional higher tiers that you are paid services that you can opt into once you are part of the CE Broker system, but nobody is required to do that. But enough people just voluntarily do that it makes it profitable enough for them. So, but it's been a good working relationship with CE Broker. We've actually moved the social work method to approve CE providers as a BSRB approved provider to the CE Broker portal as well. And so really, really nice tools on that interface. And if you do experience any issues when you get notices about CE Broker, please let us know that we've been able to work through most of those pretty well. Another update about operations, we are fast approaching the end of the calendar year, and every spring, the legislative session starts up at the beginning of January. Items relevant to the BSRB is that officially the legislature has about 90 official days of work in which they hold committee meetings, they consider items for bills, and some of those affect the work of the BSRB and the professions that we regulate. And so the board is going to have a short board meeting here on Monday to finalize items for a legislative agenda. Separately, there may be other individuals introducing bills that are relevant to the BSRB. So during the spring, I spend a fair amount of time at the Capitol testifying on different bills. And if we do have a bill from the board, trying to make sure our bill gets a hearing and then that it is passed on both chamber floors. So also separate from that, every state agency must present a revised budget estimate to the Division of Budget and Legislative Research Department in September of every year. After that point, the governor's office has the ability to review and make recommendations on the budget, which are revealed at the beginning of January. And then the legislature holds separate House and Senate budget committees looking at every state agency budget, and they can make further adjustments as they work towards a statewide appropriations bill. So usually in the spring, I'm over at the Capitol, also representing the agency's budget, answering questions. We don't receive any money from the state. And in fact, by statute, we give money back to the state to help fund operations, up to 10% of our revenue or $100,000 each year. But they can set a limit for how much we can spend of our available resources. And so we try to be mindful of different factors when we put our budgets together. And then we work with the legislature in terms of going through and answering questions about that process. So if you are trying to reach me during the first few months of the year, email may be the preferred method because I will be spending a lot of time out of the office back and forth across the street. But it's a very interesting time of the year. I always enjoy it during the session. And so I hope you follow it this year as well. So moving next to some topics, I always try to keep the advisory committee members advised about items from different board meetings. And there was a board meeting on Monday, November 4th. And there's just a handful of items I wanted to make you aware of. One, even though this is a separate profession from you, I do think it's important that you know what's being talked about for the different professions under the BSRB because there are uniquenesses for the different professions, but there's also some areas of similarity. So one of the items that was discussed at the last board meeting in November had to do with a recent conversation concerning the psychology profession and their licensing examination. And that test is known as the EPPP. That test has largely been regarded as a knowledge-based test, and states looking to standardize skill assessment had asked ASPPB to develop a second test that would be an assessment of skills. For the last several years, that second test, known as the EPPP2, has been something that states had the opportunity to require or not, but it was a choice made up for each state. About 2 years ago, the board of the Regulatory Board Association, the Association of State and Provincial Psychology Boards, that board made a decision that if any states wish to continue to use the regular licensing test after January 1st of 2026, they would need to require passage of both tests. It would be rebranded as one test with two parts, but they would make it a requirement for all states and Canadian provinces and territories wishing to use that test for their profession. And so over the last couple of years, that has resulted in a fair amount of pushback, also a fair amount of concerns. There are two separate costs for their licensing examinations. Also, if you pass one but don't pass the second one, you're not able to get licensed. And some states were basically saying that they don't think they would be able to require passage of the second test to get that into their statutes and regulations, which would mean as of that date, January 1st, 2026, they would have been left without a licensing examination for their psychology profession. So there was a movement by different states to propose a bylaw amendment to ASPPB, that association, basically giving states the ability to choose whether or not to require that second test. And I think there was enough momentum that it was likely to pass. And so leading up to that annual meeting just a few weeks ago, the board of ASPPB met and decided that they would pause their previous announcement and would no longer require passage of both tests as of January 1st, 2026. But there was still a fair amount of concern from different states because everyone was wondering what's going to be the path forward concerning that second test. And so the bylaw amendment still moved forward at that meeting, if not for nothing else, to facilitate the conversation. And on behalf of our board, we had a thorough discussion at the advisory committee level with the licensed psychology profession advisory committee and also the master's level psychology advisory committee, and collected information on the test. And both of those committees made recommendations back to the board to support that bylaw amendment because of various concerns about cost, about issues related to could this be make it more difficult for people to join the workforce, and different things like that. And so with the announcement from the board, I went to that meeting on behalf of our board and basically said, what did you mean by the word pause? Anything that's paused can be unpaused. And I think we all need to know what the board of ASPPB really intends for this licensing examination. And so several board members spoke and said that was probably a poor choice of words. And it was their intention really to bring this back and have a new task force set up and have a lot of states thoroughly work through this, trying to make a more unified version of the test in the future that would be more palatable for different states. And so this is not something they plan to just temporarily pause and then unpause. But going through this, there was a lot of good conversation, and it demonstrated sort of the value of these national associations because it did bring a lot of states together to have hard conversations, but important conversations about the value of licensing examinations and the roles of states working together, and also figuring out a path forward that's going to work for different states. So I know as a composite board, we belong to several different associations, and I try to give you some updates when, Mary and I go to the National Association meetings for the Marriage and Family Therapy Advisory Committee or the Regulatory Board Association. But I think it's also relevant that you kind of hear the information that is taking place for the other professions as well. So ultimately for psychology, they're going to have more time to work on a path moving forward, but I wanted to keep you updated on that. And so that is an update that the board did discuss a fair amount also this year. Some other updates from the November 4th board meeting. There were a few different requests for statutory changes that had been forwarded to the board from the advisory committees. One of them was from your advisory committee that dealt with the language we talked about at previous meetings concerning individuals preparing for the practice of marriage and family therapy. You may recall in the Practice Act, the Construction of Act language does basically say individuals providing marriage and family therapy in general need to be licensed and under the authority of the BSRB, but that statute does include some carve-out language, which includes individuals who are students, interns, or individuals preparing for the practice of marriage and family therapy. The problem is that term, preparing for the practice of marriage and family therapy, that group really had never been well defined, and that language was a bit vague. So we had taken it to originally the Addiction Counseling Advisory Committee. That's where we first found that language in the statute. But then there was similar language for the Marriage and Family Therapy Advisory Committee to weigh in on. And so your committee, similar to the Addiction Counseling Committee, recommended to the board just removing that language from the statute, as we don't see that it was intended to help out a specific group of individuals, and it creates a vague standard, and it creates difficulty for us to enforce the requirements for licensure. So the board did recommend the same as the advisory committee had recommended. The board will be requesting some statutory changes to remove that language from the statute during the 2025 legislative session. Additionally, we've talked about supervision a fair amount between the different professions this year. We've talked a little bit about how the marriage and family therapy profession and also professional counseling are a bit unique in that there is a board-approved process in law for both of those professions. Additionally, there is some language that is in the regulation that provides flexibility for someone from another profession to provide supervision, but with the transition to allow all supervision by telehealth, the standard changed to having to show an extenuating circumstance for needing someone else from another profession to provide that supervision. And that extenuating circumstance bar is very high. And so we have had a number of individuals and a number of employers reach out to us with requests for more flexibility based on different things like cost concerns and workforce related issues, asking us, would there be alternative ways to meet that bar, or would there be some movement on the board's behalf in terms of allowing more supervision from other professions? And so your committee had talked about that. You had considered alternative measures, and your position as an advisory committee was to go ahead and stick with the existing language in the regulation, allowing for some small flexibility, but having that high bar stay in place. For the professional counselors, they had recommended to the board some different language and requesting actually that the board seek statutory language to permit up to 50% of the supervision hours for individuals seeking clinical licensure for the professional counseling profession to be provided by somebody outside of that profession, as long as they had the right qualifications and the appropriate level license under the BSRB in a different profession. So right now, the professional counseling profession is the only one that has brought forward a proposal to the board as a recommendation, seeking that flexibility for their profession. There would still be language that would require half the hours to be by someone who was a professional counselor, but that would sort of be put forward to the legislature as a compromise position, wanting to retain the value of supervision provided by someone from that profession, but also acknowledging the request for individuals with more flexibility. So that is a recommendation the board heard, and the board did agree to seek statutory language to change that to see if that could move forward this year in the legislature. And then the last item had to do with a psychology advisory committee recommendation to the board. This had to do with some language in their educational regulation. Previously, what the standard was that if someone received their education from an accredited school, from the American Psychological Association, APA, they would have also had to meet the specific coursework requirements listed in the educational regulation. But for most of the professions under the BSRB, those specific coursework requirements are more intended for people who come from non-accredited schools. And so what the advisory committee recommended to the board was a change to the language that would allow individuals who receive their education from APA accredited programs to essentially move through the process more quickly, but for individuals who came from non-accredited programs to establish that educational equivalency, they would still need to meet the program level requirements and the coursework level requirements listed as an alternative in that education statute. And the board did recommend that as well. And so just wanted to touch upon some of those items. As I mentioned, the board will have a short meeting tomorrow to finalize items for legislative agenda. After the House has recently named committee chairs, and I did want to let you know that the committee most likely that will be working with the most will probably be the House Health and Human Services Committee. And I did learn that the chair of that committee is Representative Will Carpenter. And I was very happy to hear that. Representative Will Carpenter has a long history with the legislature. He has previously worked as the chair of the Social Services Budget Committee and spent several years in that position really working with agencies like the Department for Aging and Disability Services, Department of Health and Environment, Department of Children and Families. And so he is knowledgeable about a lot of health-related issues, and I really have a tremendous amount of respect for the work that he has done for the legislature. I think most recently he was chair of House, Fed, and State. So happy to see him as the new chair of the House Health and Human Services Committee. I'm still waiting for the appointments to be released for the chairs for the Senate committees, but hope to have that information soon. So, and then last, I will say we will try to, touch on this at the end of the meeting, but I do want to take this opportunity to thank all of you for your work this year on the advisory committee. The discussions that we have had here have been very valuable. I think it's really helpful to have a composite board with strong advisory committees like we have in Kansas. And what I've seen looking at other states is that there has been a movement recently to move to structures like the BSRB. I think in part because of how effective and efficient this model is, where it still allows the professions to have good discussions related to each of them, but also be able to provide those back to the board and have a composite board of professionals and public members working together to reach good decisions. So I appreciate all of you volunteering your time. We definitely couldn't do this work without you, and look forward to working with you all more in the upcoming year. So with that, I will go ahead and end my report and see if there's any questions.
Yeah, thank you, David. I'll just interject too. I think it is your work among those national groups that have let them know how effective our board composition is. And so thank you for your leadership in that as well. Any comments or thoughts for David? I know a couple of things he talked about, well, the items he talked about in supervision will come up on our agenda later, so we'll touch on that. But are there any other questions or comments regarding his report?
I just wanted to share, I know that we had that conversation, gosh, months ago about the supervision for MFTs. And I think that was such a great conversation. I think it is good that the professional counselor group is having that conversation too. I think the dynamics look a little different than within our world. I think, not that I think that there's like an over influx of supervisors, but I do think it's easier within our field to obtain that. Whereas for the professional professional counselors, I have just seen that it's been a really big challenge. And so I'm hoping I'm seeing a lot more people come out of those programs though. So I'm really hopeful that's going to shift for them, hopefully over the next few years as they get more people clinically licensed and able to provide that supervision. So I have a friend that right now is struggling to find somebody. And so really looking forward to hearing more about that, but also support, within our field, that recommendation that we made. So that was just more editorial than anything. So thanks, David, for sharing that. And I'm really excited to hear what comes of it.
Thanks, Nicole. Any other comments, thoughts, questions? Okay, I think for the purposes of our meeting time today, we'll move into the old business pieces and then come back to the annual training towards the end of our meeting. Dave and I have talked a little bit about the annual training, which we know we can split if needed, if need be, so that we don't, if we run out of time, or if not, we can decide to move through that. So if it's okay with the committee, I'd like to move back to the conversation on the old business item A, which is discussion of AI. We had a presentation at the meeting, last meeting, and I think it got us thinking about AI differently, and just wanted to touch base and follow up if there had been other thoughts and considerations since our last meeting. I know I've been in some conversations recently where people are talking about AI supervision, and it made me think, Chris, if you had any thoughts about this actually, because I was thinking about that in terms of program and accredited programs, and if you're hearing or seeing things about the use of AI supervision in graduate programs, but then also thinking about it in post-grad. There's lots of things happening here. It took me a couple of days to even think about that concept myself. But anyway, just to open up the floor for conversations, things we might be considering, thoughts we want to bring back to the larger board as we continue to have these discussions.
I just would offer a general comment that we're talking a lot about it here, and just in meetings more as things come up and we're discovering things. And I think more in the classroom as opposed to supervision at present. But the conversation we were having about with Ben Caldwell, especially about the different technologies that are available, are becoming more and more relevant, I think, and especially a program like ours that has students in 25 different placement locations, just learning to pay attention to what each location is doing and learning, I think, to ask about those types of things in ways that we might not before.
Thank you for that. Other thoughts, things since our last meeting?
I really appreciate that feedback, Chris, because our agency is looking at implementing Elios for our clinicians for during session. So it's not providing any of the care, but it's, helping with the documentation side of things. Because as we all know, it's one of our, it's just a pain point for most providers who just want to provide good care and not have to focus on all of those things as much. But then, yeah, as you were talking, I'm like, oh man, once we get that implemented, I need to reach out to all of our programs that we've got students with to see, is this going to be okay for them to use? I can share about our policies and procedures. And so I'm glad that you mentioned that, because I think that's something that all of us need to be aware of as we're working with students. But then also a big thing on our end is the consent side of things with clients. That's going to be a really big piece, is if a client doesn't feel comfortable with this, even though it's just for the purpose of documentation, and we can even share what's happening with with it afterwards to protect their information, we have to respect that, even if it feels inconvenient for us. And so we're having a lot of those discussions right now. And we knew that we had to get ahead of this because we were worried that our staff, even though we would hope that they're being ethical in everything that they're doing, we were worried that they were going to start using stuff without us having some oversight and policies and procedures in place, just because AI is so prevalent in our world right now. Even in my email right now, or like this morning, I was putting an email together for somebody and it could predict who I wanted to send it to. And it was exactly who I wanted to send it to, which was just so wild. And so it's everywhere. And so I think, yeah, those are good discussions. And I'm really glad you brought that up, Chris, too, because now I've got to be I've got to be aware of all of these universities I got to reach out to and make sure that they're okay with it too. So.
Yeah, and again, the conversations across regulatory boards have been this, how do you manage what you're going to put in terms of guardrails for regulatory language without being constrictive, but also, being mindful of the responsibility of keeping people safe. And, I've mentioned it in here, but I think I still look at it like it is really about a guardrail. It's about informed consent. It's about, some level of client choice, whether or not that's even applicable in some healthcare records, because they may not even be available. But other thoughts, comments? Are there particular places where you think the board needs to be looking at creating language sooner than later, sticking out for you all?
I would suggest around the topics of client care that any form of client care is not directly provided by AI. And then I also, in reading through some of the materials and in talking to some other colleagues, I have just a continued concern about HIPAA and confidentiality, and how AI might compromise that.
Okay.
And I think that goes along, Marcy, with what you're saying about, client consent. So, I mean, even when people come in for a service with you, you have to talk about the risks and benefits of therapy even. And so I think this falls in line with that as well. We have to do that with telehealth. We have to talk about the risks and benefits. We've got a HIPAA compliant platform that, we've got information that says everything is protected, but there are breaches that happen in our world. And so I think around, risks and benefits of using AI and client consent, which I think we need to do with everything, but I just kind of wonder if we need to be explicit with that in this as well.
I'll just add, as the public member here, my background is in risk management. And one of the things I'm still working with several healthcare institutions with respect to AI is that patient consent to AI does not release the practitioner or the organization from HIPAA responsibilities. And even if they're compliant, we're still waiting for the big test case to come. And we all know, well, I know, at least in my medical malpractice history, the big case hasn't hit yet, and that will define everything going forward.
Definitely a good point. Case law usually dictates what happens next, right?
And this may be opening up more of a discussion. Do we want, Chris mentioned the classroom, and I know that in our program that's also been a topic of discussion. And so is there room to allow, educational institutions on their own to determine how comfortable they are with AI? And, do they want an AI generated case study? Do they want an AI generated suggestions for next session? Those are all available. Or do we want to make suggestions that are more regulatory in nature and overarching? Or leave it up to the individual institution, or just, I'm afraid if we just
I think that's a great point, Marcy. It's like, as a regulatory body, the board's job is to, not manage every little thing, right? And so having some opportunity for institutions to create and set their own practices at a high level. What is the board's responsibility in saying it's your obligation to do these things, right? So, good point.
Yeah, and that's an interesting conversation because we touched upon something similar in the professional counseling, I think it was, advisory committee. We were talking a little bit about some of the carve-out language that applies to students when they are in an academic setting. It basically, a lot of the construction of act language says that the requirement to be licensed and under the BSRB generally does not apply, or it's not intended to prevent people from providing services when they're students or interns in an academic setting. But how far does that extend? If students in that are providing services in a way that is inappropriate, we talked about the supervisors at the schools, and what level are they responsible, and at what point does the BSRB need to get involved if something is really, problematic? But we got into a conversation about the unprofessional conduct regulations and about improperly supervising someone. But in an academic setting, it's a little bit, it's not as clean as it is when everybody is licensed. And so and also it kind of goes towards most of the time the BSRB doesn't really tell the schools what to do in terms of the coursework and programs. It's really more of if someone applies for licensure, we look to see, did they attend a program or a school that offered this and this and this. And it's up to those schools and programs to decide if they want to have tracks that are intended for licensure to see if they meet those standards. But it's not the reverse where, the BSRB is necessarily telling schools they have to require these things. It's really just if those schools are trying to meet the requirements for licensure for their students. And so definitely something for us, I think, to look into more, maybe across the board for several different professions, at least to make sure we all have a good understanding of where the lines are in terms of people providing services in a school setting, and what role the BSRB should play, or licensing boards in general, concerning what's taking place at schools, perhaps. I do know that the psychology profession, in one of their advisory committees, they were talking about the value of doing, assessments or psychotherapy in person versus by screen. And they were saying, how close are we someday to doing psychotherapy by screen to an AI tool versus a person? And how different would that be? And would that be, something that we would need to take a position on as well? So it's interesting, these conversations going in different directions. So just thought I'd share some of those comments from different places.
David, it's interesting you mentioned that, because that's one of the things I was thinking of. I'm aware that the medical training that AI generated practice work is happening.
Any other thoughts or comments before we leave this conversation? I think this is going to be an open, ongoing conversation through the advisory committees and also the board. I think at this point, don't let me speak out of turn, Dave, but I think we've all struggled to what would we actually draft and in terms of this, because I think we're trying to gather thoughts and opinions, look at these, have people like Ben Caldwell coming in and talking about what things make sense, and also trying to lean on other regulatory boards and what they're doing. So I think we might be a little bit ahead of the game, but everyone, I think, has this on their radar.
Mm-hmm. I agree.
And Mary, from the public perspective, I'm here to watch out for the public's benefit, and each of you in your daily lives watch out for the public's benefit and how you take care of your patients. It's up to you all to help define what the future looks like. You can watch any episode of any science fiction show and you have somebody going to counseling on their iPhone now, or a 3D image that sits in their living room with them. But remember, all of those things are at least theoretically put together by other people's thoughts, and we need to know where those thoughts come from, where that practice comes from, what's the basis of their assumptions, and where they go. And the mix here in these advisory groups is going to be helpful to protect the public, because these things are going to happen. It's not going to stop. It's going to get better. It's going to get greater. But we better make sure we have our finger on the pulse of what's going on.
Thank you for that, Jim. Okay, well, the next item we had was about adding descriptions of professions to the website to inform the public.
Yeah.
Dave, do we have updates on that?
Yeah, I just wanted to touch upon this and just kind of let you know what the other advisory committees are. I think we've reached a consensus between letting the different advisory committees discuss this topic and consider different approaches. And I think, what we're probably going to move to is, we've had good discussions in most of the advisory committees about adding some general language to the BSRB website for each of the professions to let members of the public understand some of the differences between those. But also, we're going to be putting some specific language to better explain more of the differences between our levels of permanent licensure as well. So Kansas is a bit unique in that we have 2 levels of permanent license for the marriage and family therapy profession. There's a lot of states that only have 1, and it's the independent level of practice. And so what they might refer to as a licensed marriage and family therapist, for us, that means something different. It's a permanent license, but it's not the independent clinical license. That would be a licensed clinical marriage and family therapist in Kansas. And so some of the language we're going to be adding to the website will make sure that people understand that both levels of license are permitted in Kansas, and that does make us a bit unique. And then we'll try to clarify a little of the requirements in terms of the education, and maybe even touch upon the test, so that if there are other individuals, maybe from other states, that are looking to see, which state should I practice in, or which state should I want to move to. I think, we talked about this a little bit at the Marriage and Family Therapy Regulatory Board Association meeting earlier this year. that there are a lot of states that basically, if you cannot pass the test at the clinical, at the correct total to become clinically licensed in other states, you're not going to be able to get permanently licensed there. And then they've seen people basically change professions. But those same people could potentially come to Kansas and practice at our lower level license and stay there for their career, providing good services to people. And so I know a lot of states are trying to look at workforce and address this, each state for themselves. But as we're doing these multi-state compacts, we're really kind of moving towards a different perspective where people are working in multiple states and there's more awareness. And so I'm optimistic and hopeful that we can share what we have in Kansas in certain ways. And perhaps that's a nice way for us to actually attract more people from other states to come and practice in Kansas and get supports and provide services. So just kind of wanted to touch upon what the other advisory committees have been discussing, where the language is kind of moving forward now. And so I think this is not going to be something, large. And if you do want to see it once it's posted on the website, we will let you know where that's going to be. But it'll probably be just in the frequently asked questions section, just a couple paragraphs, and it'll a little bit more clearly define marriage and family therapy as a practice. And then also for Kansas, the two different levels of license and what some of the differences are in terms of what people are able to do, and then also the requirements for getting the two levels of license. So just kind of want to give you some updates there and see if there's any questions.
Questions, comments, thoughts there?
If not, I think this will be one of those items that we'll just consider sort of wrapped up for the end of the year. So when we start talking about items next year, we can just kind of put this topic to bed for it.
Sounds good. Thank you. So the next item is the continued discussion on supervision. I think we did make a recommendation from the advisory committee, and because there's still we have the new information that Dave said, where the professional counselors put forth the recommendation that the board approved to take forward in statutory language. And coupled with the fact that I know there are some groups around the state of Kansas, whether they're advocacy groups or lobbying groups, that are interested in looking at supervision requirements, that you wanted to sort of bring this conversation back to know, as we've discussed, I think anytime there's statutory language that's opened up, there's an opportunity for people to look at other professions or make other recommendations or just make changes, whether or not they're necessarily supported by advisory committees or the BSRB itself. So thought there's still time and opportunity to have this discussion. Nicole, I appreciate your comments from earlier, because I do think we had a very nice discussion about what it means to be an MFT in our field, in our profession. And because in light of that LPC recommendation where they're allowing that 50% supervision otherwise, just wanted to see if there had been other subsequent thoughts or thinking around that, or are we good with that first recommendation that we really don't want any change, versus looking at mirroring what LPCs are recommending to the board.
And I'll add one more note on this topic too. One of the discussion points for certain groups that I have heard as well has been, the desire for more flexibility from people from other professions, and even questioning the board approved supervisor status that is for professional counselors and marriage and family therapists. I think, if there is greater flexibility, the proposal the professional counselors put forward is that those people would still need to become board approved supervisors. But like Mary said, if this goes before the legislature, if individuals do want even more flexibility, it's possible that they may say, it's possible they may target the board approved supervisor status that we have in Kansas. And so just kind of wanted to bring that back to you as well, to get your thoughts on the board approved supervisor topic as well. That has been in Kansas now for a few years, and I think some of you have seen how it's been working, and maybe it'd be helpful just if you could kind of share some of your comments there, to see if maybe if it's working like it was intended, if just any thoughts on those two things, either the supervision, like Mary brought up on the agenda, but also as it relates to the board approved supervisor status.
I don't know that my thoughts make sense, but I'm going to share them anyway. I seem to have in my head that it was professional counselors that were really the ones who wanted the board approved nature in the first place. I mean, honestly, we have such a thorough training to be a COA accredited, I'm not COA, an AMFT accredited supervisor. I felt like we had a pretty high standard already. Now, not everybody was required to do that, um, but that certainly was a credential that we already had. I I guess I So that's one thought. I'm intrigued by the variance of professional counselors that are wanting to expand it when they were kind of wanting to have the credential in the first place. So I'm not sure really of the. I'm just trying to make my own sort of sense of that. Um,
Yeah, and I think in terms of, one topic too, we reached out to the Kansas Counseling Association to
Yeah.
get their position as well, and they submitted a letter to the board. Um, but then in further conversations with representatives from that group, I think there is a desire that there's a strong preference. They don't want there to be so much flexibility that people are getting no supervision from professional counselors. So I think as a compromise solution, this is a helpful approach to say we still value that some supervision be provided by professional counselors for that profession, while acknowledging, maybe there can be some flexibility to allow for other professions. But I think some of that may have come from a concern of too much flexibility so that none of the supervision would be provided by professional counselors.
well, I suppose if we're talking about the high bar issue, I still want to maintain a relatively high bar for MFT because I just have in my head a desire to maintain a measure of orthodoxy in terms of the field. Um, on the matter of accessibility, I do recall when that first came out, it was our students were having a I should say, as our students were thinking about graduating and then thinking about postgrad supervisors, it was quite hard to find. Because I'm continually downloading the list to see who's there because students are asking about it. And for a while, there were not a lot of us. Now, with more training, that's expanding quite a lot. So I feel like the accessibility to MFT board approved supervisors is improving, but that was a problem for a while, is there weren't a lot of people that and I know students our graduates were having a hard time finding people. That seems to be improving.
Yeah, I agree, Chris. I think that was one of the things Dave and I spoke about too, was because we have the approved supervisor designation through AAMFT, we have a very high bar of providing that. And I do think it's important for us. When I look at how the landscape has changed over the years from when the approved supervisor designation for Kansas came in, I think that's really what you're seeing is a function of um, all of the issues that are happening across the nation, just in terms of workforce and accessibility to supervision, but also the profession and ensuring that we can continue to keep people moving into the profession. So I think there's a lot of variables in that. But if I'm hearing you, and I don't want to put words in your mouth, but that, because we have this other designation that's available that's really much more difficult to obtain than a Kansas approved supervisor, there's a level of comfort there because I do think that many graduates try to look for AAMFT approved supervisors.
Things may have changed, but in some states,
Mhm.
I think there is a requirement that it's written in their statutes that a supervisor has to be an AMFT approved supervisor. So I've always encouraged people, to me, I think it's to your advantage to have an AMFT should you go to another state and that be an issue of some kind. Um, if you're an AMFT approved supervisor, it's relatively easy to get the board approval. Met the standards pretty easily.
We've also heard, and not necessarily from within our discipline, but outside of other professions where it's been difficult for people to obtain the training in the particular coursework that, there are some people who've made business of that, and that can be a very costly endeavor as well. And so I think there's that thought too, which is, I guess the evaluation of, did it do what it was intended to do? Do we feel like that board approved designation in Kansas has actually enhanced the supervision of the licensees as they move through postgraduate? So I think there's some interesting thought maybe around that.
That's something that I was going to mention, Mary, is I had held off doing it for a while because of the access to some of the training. And then I happened to, I'm not on social media very often, but I happened to see somebody from the Wichita Friends program, a couple of years ago mention that they were going to be doing a training. And so I jumped on it, but it was the first one I had seen promoted for a long time. And so I didn't even know where to look to find how to do that, and everybody had told me, oh, well, I went through a course put on by somebody that would, and so I think some of that's probably true for other professions as well. And if I'm remembering right, I could be speaking totally incorrectly, but I don't think all of them require it to be a board approved supervisor. I don't know if MSWs.
No, they don't.
I think they
Just
just
LPC and MFT.
Okay, I was gonna say I think they have to be an LSCSW that's been practicing or has been an LSCSW for 2 years, and so which I'm not saying that I think that that's the best either per se. I think I appreciate the sentiment behind it because there were a lot of things I learned in that training that have really helped me navigate some really tough situations, and I go back to it regularly. But I think the access to that is challenging, and I don't know if that's something this group looks at or just continues to go back to the spaces that we're in to promote implementing that. But I think that is true probably of the LPCs as well.
Yeah, so just we haven't heard from everyone, so I don't know if there's opinions, but I'm hearing this sense of feeling like that approved supervision designation is not as important as getting supervision from an MFT. Is that an accurate statement?
I don't know if I would
Please.
say that. I don't know if I would say
Okay.
that.
Okay. Yeah, just trying to hear from everyone. Thank you, Betsy.
I'm on the tail end process of my AAMFT designation. It's taken a lot of time,
Yes.
a lot of money to get it. But I'm getting it. But I'm also a board approved supervisor. I think probably part of the reason why I haven't experienced the difficulty in finding training was that my training, I already had it when I came into Kansas from working on my California Association of Marriage and Family Therapy supervisor designation. So I already had like a 30-hour. Sadly, in California, you only have to be licensed 2 years and take 6 hours of training to be a supervisor. Never really agreed with that completely. Seemed kind of light. So I don't know that I would say, I don't think it's important to have the board approved designation. I think when you have somebody in that power dynamic, I would want somebody who I know has gone through some training. I also still feel like I think MFTs should be supervising MFTs. Part of that for me right now, I have a really, really new graduate who is an MFT in an agency where they're the only MFT. And if they were being supervised by somebody who wasn't an MFT, it would be difficult for them to retain their systemic focus, which is essentially the core of who we are. And so I think it's very important to keep the grounding in what the education has been. So I wouldn't say I don't think the approved supervisor designation isn't important. I think both are important to me. I want a supervisor to have gone through training that has been, I don't know if you'd say verified or codified or something, to ensure that they understand their power dynamic that they've got set up, and then also have them be in the same discipline, just to maintain the focus. And that's coming from somebody with a master's in professional counseling. So just saying.
Thank you for that. Diane, any thoughts?
I agree with holding the MFTs at a standard that's a little different. Through our training, we learn a lot of different things than social workers learn. And I think it's important that we be supervised by MFTs because we're trained differently than the other professions. As far as the AAMFT supervision requirement, I'm just a board approved supervisor. I don't have the AAMFT designation, and I can tell you I don't get referrals for supervisees very often because I don't have that. So I think it's something that some of the institutions promote more, is that they need to find a supervisor that's AAMFT approved. And I don't disagree. I just personally didn't go that route.
Diane, I'm in the same boat as you. I didn't either. I mainly got it so I could provide it at my work. But I'm really clear with everybody that I'm not double AMFT. I'm not a double AMFT approved supervisor, and I understand if they want to seek that with somebody else. I'm very, very open about that I am BSRB approved, all those pieces. So I'm in the same boat as you. But I'm also not looking for adding on to that outside of that at this time. If I were, I think, I would see maybe where I would want to do that.
And I'm not either. And I feel like I got some really great training from people that are double AMFT supervised. And I feel like the training was thorough and intense, and I worked really hard at it. I just didn't take the next step to get approved through them.
Thank you. Marcy, any other thoughts from you on this topic?
No, I'm just agreeing with what's been said and thinking through, as someone who has trained supervisors. I am AMFT approved. I'm not board approved, and so I'm in a little bit different situation than Nicole and Diane. And I see, since we have many students who leave Kansas and are going to states, that they feel the consistency of an AMFT approved supervisor will help when they do apply for licensure in other states. So I think that's a benefit. I strongly feel that MFT supervision, MFTs need to be supervised by MFTs. I think that's just really needs to happen. So I'm curious, I guess, to the reason that I understand the reasons that people would not seek AMFT approval, the time and the expense and all of that makes sense. And I guess I'm curious as to why sometimes AMFT approved supervisors don't seek BSRB approval. And so are we missing some there as well? In my, it's been a time thing and things like that as well. So just curious.
Yeah, good question. I don't have an answer to that one. I don't know if anyone has any thoughts on that.
Well, I can say, just from a practical standpoint, there have been some benefits to the licensing board currently with our setup, having the board approved status, because we have an easily quantifiable group of people. And earlier this year, Leslie Allen sent a message out to the board approved professional counselors to see how many of them were still interested in taking on more supervisees. And so we did get about 100 people back for that profession that said, I'm currently supervising and I am still taking on more people. So we have the list available to send to people, but now we have sort of a condensed list of people that are open to taking on more supervisors as well. And for the other professions, we know who would be able to supervise, but not necessarily the same information. And so we have started to have discussions about maybe adding an additional question to the license renewal process to ask people if they would be willing to supervise when they renew their license, so we can start to build a list for people that don't have the board approved, in professions that don't have the board approved supervisor status. But at least from a technical standpoint, it's been helpful for us to be able to provide those lists to people, whereas we don't have the same sets of lists for the other professions that don't have the board approved supervisor status. Not to say anything else about, you know, other aspects of that program or that setup, but that is something that has been helpful for us. So. I think someone did make a comment about, you know, did the other professions have that board approved status or not? And it is just the marriage and family therapy and professional counseling professions. The social work, there has been a couple of attempts to add that for that profession. It was recommended by their advisory committee, I want to say maybe going into the 2021 legislative session, and then also going into the 2023 legislative session. And both times when it was heard by the members of the committee made a motion to amend the bill to take that section out. So, so the advisory committees have been supportive of it, but the legislature has taken that out. And I think there has been some opposition by the State Association of Social Work in ASW Kansas has come out opposed to it when it has gone before the legislature. So I think at least the state level association for social workers has opposed the board approved supervisor status for that profession. So I don't foresee that changing in the future in terms of that profession becoming board approved supervisors.
Well, thank you once again for the discussion. I think it's a hold. What I hear is this is a hold tight from where were in the last conversation, and that's fine. I think it just because there was opportunity to talk about it. I was glad to bring that back to this group and get their opinions, and I appreciate all the thoughtful comments that everyone's making. So hopefully that's what will stick. But I appreciate understanding where the advisory committee is on this, and I'll make sure to give that back to the board. Okay, we have on here additional topics for 2025. So I just wanted to see if there are particular things such as, you know, the speaker on AI or something that this committee wants Dave and I to work on bringing for 2025 or special topics. This would be a good time to talk about it, and always invite that if there is a topic that comes up later, please send us an email and we'll be happy to work on that. Does anyone have any ideas in mind for next year? Beyond the AI, which we know we'll continue to bring back. Any issues that you're hearing from either students in an academic setting or from postgraduates that maybe we could dive into a little bit next year?
Would like to bring something up that I have had several clinicians in our area talk to me about, and that is the difficulty in getting the CE hours for ethics and things like that. And so just wondering and not knowing, sometimes going to things and not knowing if it's going to be approved or not approved. And so if there would be a way to streamline that a little bit, or even have some standardized online courses, those types of things, that was brought to me. And so I said I would bring it up.
And I think that's a good topic for us to talk about in 2025. I do have a couple of updates that I think may be helpful concerning that. So we had a discussion earlier this year about possibly looking into a jurisprudence examination requirement or something for Kansas. And it didn't seem like it was the right approach based on a number of different factors. But a lot of that information is still really important for our licensees to know in terms of the laws in Kansas and different things like that. So what we proposed was essentially launching a series of webinars, 1 hour per each profession. We're going to try to do those quarterly, And the way it would work would individuals would be able to log in and follow that 1 hour webinar put on by the BSRB that would go over information that would be the same kind of material covered by a jurisprudence examination. And it would be free to attend. And at the end of the hour, if someone had attended the full session, they would get 1 hour of continuing education in ethics. So this is kind of a nice thing we're going to be implementing here in the near future. And it'll be just 1 hour probably each quarter, but that will be a way to get some additional ethics hours that way. And then also in terms of knowing for sure if something is going to meet the standard for the BSRB, one of the reasons why we don't generally give advisory opinions about CEs on the front end is because if we were to do that for all courses that people are taking, it would take quite a bit of staff time, and only 10% of our licensees currently are audited upon renewal. So for the social work profession, they previously had asked for a process by which individuals could become a board-approved CE provider or have a course specifically BSRB approved. So they would submit that, pay a fee, and then they would get that designation. It's not a requirement, but social workers wanted that. And I think some providers wanted that to be able to advertise that for that assurance. And so one thing we did bring to the board is with working with the e-broker, we thought it would be the right time now to open that up to the other professions, to allow for other providers of CEs to be able to, we need to get it through the statute first, but if we can implement this in the statute in the spring, it would allow CE providers for other professions to essentially apply to the BSRB to become a pre-approved provider or have a pre-approved course. And if they are pre-approved, then that would be something they could advertise and designate ahead of time that they have met the standards of the BSRB. And so, and there is a way that those providers would be able to apply to do that process through the CE broker module. Then those courses would actually be listed through CE broker as well. So just a couple other services that are kind of being linked through this new partnership with CE broker. But I think there's probably more work we could still do on that area. So not to say, we shouldn't talk about next year, but just a couple of quick updates. We can put it on the list to continue to work on those things for next year too.
Thank you.
Those 1 hour webinars largely cover professional conduct, or would they get into like ethical decision-making types of things?
So we're trying to model them off of jurisprudence type questions that we can find as examples in other states. So I think it'll be sort of a combination of, at least from the beginning, our initial approach is probably going to be a blend of what is in the unprofessional conduct regulation plus some of the traditional statutory requirements for licensure, things that some people stumble with. For example, some people might renew their license and still have a week or two left in their license period. And they say, oh, well, I still have another week or two, so I can get a couple more CEs before my license expires. Well, not the way it works. When you renew, you sign the attestation that says, at this time, I am affirming and swearing to the board that all my hours are complete. So if you are selected for audit and you haven't finished your hours by that point, it really is a violation. And so it is to everybody's benefit if everybody's on the same page. So bringing some of that information forward through some of these questions, highlighting those topics, we think that'll be helpful. So some of it will be just the, what's required for licensure and renewal, and then other things would deal with spotlighting some of the unprofessional conduct standards too. So close to ethics, but ethics is more of the product of the association, and professional conduct is more of the fiction of the licensing board. Yeah.
It's just, honestly, it's helpful to kind of hear that there's a need there, because I'm sitting here thinking as a program, this is something we could start providing.
Well, and we've heard from some schools that basically asked if their students could attend these webinars too, and there's no reason that we would see any issue with that. And so this will be open to licensees. It'll be free. It'll be voluntary. This is sort of our approach to say, if we use a carrot approach instead of a stick, if we make this with the benefit of the free hour of CE and make it sort of a fun learning experience, will we have people voluntarily signing up for it so we don't need to consider making it a requirement in the future?
Great, thank you. Are there other topic ideas? Things that are coming to mind that we should look at? Well, I'm most certain that the board will bring things to the advisory committee, but just know that the advisory committee can also bring things to the board's attention. So please, if you have thoughts or ideas, as we mentioned before, just feel free to get those to us, and we're happy to get those as topics. But I think this is a good topic for us to continue to bring back. So thank you for that. And thanks for the update, Dave. Okay, we will transition then to the training, our annual training for advisory committee members. So Dave, I get to hand this to you.
Great. Thanks, Mary. So for some of you that are new, this is a once a year annual training we do for each of the advisory committees. And some of the information is specific to advisory committee membership. Some of it is specific to board membership, but I do think all of it is relevant for you on the advisory committee. It's helpful to kind of know how the advisory committee fits within the greater mission of the board. And also there's some language in the advisory committee policy that says basically the same policies and processes that relate to board members should also relate to advisory committee members. So in terms of the values that the board has chosen to stress in terms of some of their policy documents, that's relevant. And also the, we have had a number of advisory committee members go on one day to become board members. And so it's really helpful just to kind of put everything in perspective. Some of this is going to go over information relevant to the different BSRB advisory committee makeup, but some of this is going to be also information under the law. So if you're used to working with mostly for-profit or nonprofit groups, we have a few different rules we need to follow based on the nature of us being a state agency. So I will share my screen here, and then we can go through, and if we don't get through all the training today, we can just pick up from here at the next meeting and then finish it off at the next meeting in February. So you should be able to see the front of the presentation. And I do also want to say one of our employees here, Emma, she has been a part-time staff member. She recently graduated with her degree, and we received approval to make her a full-time staff member. And some of her new responsibilities are that she's helping me out in an assistant type role. And so I put her to work kind of looking at a few of our former processes, trying to clean things up, make things better. And she really did a lot of work to this presentation. It got up to about 140 slides in previous years, and she was able to cut it down to about 70 slides. So it should be a little bit more streamlined. The BSRB, as a state agency, in accordance with the intent of the Kansas legislature, has a mission, and that is to protect and serve consumers of services offered by BSRB licensees through the issuance of licenses, resolution of complaints, and the creation of appropriate regulations, accomplished through efficiency, fairness, and respect to all those involved. And if you look at the mission closely towards the beginning, while most of our interactions are with licensees, the primary charge from the legislature is to protect and serve consumers of services. So we are a public protection agency, and it's important that we remember that that is our first and foremost our goal. The history of the agency is that the BSRB was established in 1980 to license and regulate psychologists and social workers. The legislature took the existing State Board of Examiners of Psychology and also the Board of Social Work Examiners, put those two groups together. And then over the years, the BSRB's jurisdiction has expanded to include licensure of professional counselors, master's level psychologists, marriage and family therapists, addiction counselors, and then most recently, behavior analysts. What we are known as in Kansas and other states is a composite board. So rather than have a separate board for each profession, there is one board, and that is composed of both professional and public members. Some of the benefits of having a composite board is that the agency saves on operational expenditures by sharing resources and utilizing licensing and investigative staff for similar subject areas. Another way to understand the work of the BSRB is to contrast it with associations. So boards, such as the BSRB, exist to protect consumers, are created by the legislature, and are governed by statute, whereas associations exist to enhance or promote the profession and are sometimes created by members of that association or that profession. The BSRB has 12 staff members, including myself, the Assistant Director and Licensing Manager, licensing specialist, investigators, and clerical staff. We are a fee-funded agency. That means we don't receive any money for operations from the state general fund, but by statute, we contribute 10% of all the revenue we receive, up to $100,000 per year, back to the state general fund to help fund other state operations. As an agency, most of our revenue is derived from license fees, and our annual budget is a little over $1.1 million. All board members are appointed by the governor to serve a 4-year term, and board members may be reappointed for a second term, allowing service on the board for a maximum of 8 consecutive years. The board composition is outlined specifically in statute, which says there will be 1 addiction counselor, 1 marriage and family therapist, a master's level psychologist, a professional counselor, 2 licensed psychologists, 2 social workers, and 4 public members. The 2 basic functions of the BSRB include licensing and also investigation of complaints or discipline. Every full board meeting, we provide a current count of the number of permanent licensees under the board. And as of now, there's right around 16,000 permanent licensees that are spread across those 16 different levels of permanent licensure. Just for comparison, if you were to look at our big chart that we provide to the board every full board meeting, you can see that over about the last 9 years, our number of permanent licensees has gone up from about 12,000 up to over 16,000 currently. In terms of investigation and discipline, as a public protection agency, the BSRB investigates complaints against practitioners under the authority of the board. The agency has administrative authority over practitioners, but that process does not take the place of criminal or civil proceedings. In fiscal year 2024, the BSRB received 162 complaints / reports of alleged violations against practitioners, which was 38 less than the last fiscal year in fiscal year 2023. In terms of the investigative process, complaints are reviewed to determine whether we have jurisdiction over the issue, whether the matter involves a potential violation of the statutes and regulations for the profession, and complaints are reviewed by a subset of the board that is also known as the Complaint Review Committee, or the CRC. Some common violations include falsifying continuing education requirements or audit violations when someone goes to renew their license, practicing without a license or practicing with an expired license, having a dual relationship, which can often involve a conflict of interest, making sexual advances towards or engaging in physical intimacies with any client, refusing to report termination or suspension, confidentiality violations, or practice issues such as performing services inconsistent with one's education or accepted professional standards. While our primary focus is licensing and discipline, we also really strive to provide good outreach. So in my role as executive director, I work with the assistant director and licensing manager, and we set up meetings to speak with different groups of students, and we provide information on the licensing process and also disciplinary matters to provide a proactive approach to assist individuals before they become licensed. Further, back in January of 2021, we set up a YouTube channel for the purpose of broadcasting board meetings and advisory committee meetings in a more secure form. Since that point, we have now broadcast live or uploaded after the fact over 180 meetings that have been viewed more than 10,000 times. Other resources we offer are on the BSRB website, which is ksbsrb.ks.gov. Some of the features on the website include a license renewal portal where people can renew their license electronically, copies of forms and other application materials, copies or direct links to the statutes and regulations, proposed changes to statutes and regulations, complaints or reports of alleged violation forms, disciplinary orders, and also information on board and advisory committee meetings. In terms of our hierarchy of authority, first and foremost are the statutes, and that is law. So when a bill goes before the legislature and gets passed by the House and Senate, signed into law by the governor, that either amends or creates a new statute, and that provides our primary authority. For the board, that is primarily statute KSA, or Kansas Statutes Annotated 74-7501 through KSA 74-7511. And there is a separate set of statutes for each profession. The links on the BSRB website go directly to the Reviser of Statutes website, which is the group that does draft the law. And so you can pull up any of the relevant statutes through our website by getting to the Reviser of Statutes website. Second on the list of priority for authority is regulations. So while the statutes provide the broad framework for our authority, state agencies are able to promulgate regulatory language to really flesh out the details or how to implement the law for each profession. and there is a separate set of regulations for each profession. For example, I mentioned the unprofessional conduct regulation. There are a series of different regulations, and those are posted to the BSRB website. They link actually to the Secretary of State's website, which posts all those live. And then third, in terms of hierarchy, are policies. And these are items that are adopted by the board or agency to assist with operations. In your packet of material, I included 3 different documents, and I'll just go ahead and highlight some of the information in those documents. The expectations for board members document is a policy document that was adopted by the board several years ago, and it largely includes a set of standards that the board wanted to hold the agency to, that the board agreed to hold themselves to, and then they wanted to outline some additional information in terms of the role of the agency and the role with the executive director. Some of the guiding principles outlined in that document are that persons in Kansas should expect that licensed mental health providers are qualified, competent, and professional. That persons regulated by the BSRB shall expect equitable and fair treatment in relation to licensing activities, disciplinary processes, and administrative regulation. The BSRB shall provide all services in a manner that is timely, cost-efficient, courteous, and competent. The BSRB shall be guided and led by ethical principles, clear policies, progressive thinking, and strategic decision-making, and the BSRB shall respect the dignity and worth of all individuals. In terms of BSRB services, the BSRB should process license applications and license renewals in a timely manner, take disciplinary action when appropriate, provide timely information to the public, and maintain rules and regulations or statutes for the profession. One of the values the board wanted to stress under a code of conduct was the value of integrity. Under this, the BSRB board held that a board member should have no criminal or professional misconduct record, nor commit acts that would lead to investigations or complaints. The board members should possess sound moral principles, have courage of convictions to withstand pressures to be swayed from the public protection agenda, be honest about personal agendas and leave them outside the boardroom, reveal any actual or perceived conflicts of interest and appropriately recuse themselves from decisions or actions in those areas of interest, not represent their personal opinion as that of the board, and should be limited to about 1 unexcused absence per year. Another value the board wanted to stress was avoiding conflicts of interest. And conflicts of interest were basically explained as having any interest, financial or otherwise, direct or indirect, or engaging in any business, transaction, or professional activity which is in substantial conflict with the proper discharge of the board members' duties in the public interest. Board and advisory committee members must make public and recuse themselves from any conflict of interest that exists. This ensures the integrity of the board and all its decisions. Some types of potential conflicts include personal gain, bias, or effects on personal relationships. Some of the common components of public conflicts of interest include a board member of the BSRB should have no personal or financial benefit as a result of service to the BSRB except sustenance and mileage. A board member who may have a conflict of interest according to stated criteria should refrain from voting on that matter. A board member should disclose any relationship with any other agency or individual involved with the BSRB and be excluded from matters involving such a conflict. A board member serving as part of an organization working in any way with the BSRB should inform the board chair. A board member should not accept any gift or promotional items received and part of their affiliation with the agency for personal use. And a board member should not use their agency's name, the agency's name or agency information for personal gain. And we do get some questions about some of that language from time to time. I think the important takeaway from that is that the board really wanted to ask board members and advisory committee members to be mindful of conflicts of interest. So it's not uncommon for board members or advisory committee members to be parts of other organizations involved in the mental health and behavioral health field. You may be involved with some of those yourself. They may have priorities that are slightly different from the BSRB. The real question is your membership in those different groups, does that interfere with your ability to wear your hat as a board member or advisory committee member in this setting? And if you do feel like it conflicts with your ability to vote appropriately and to act appropriately in this way, we would ask that you recuse yourself from certain votes or certain discussions on matters. And we do leave it mostly to the board members or advisory committee members to make that judgment call themselves if they do think there's a conflict of interest. but we would encourage you to err on the side of caution if you think something could be perceived that way. In terms of personal conflicts, those are defined as actions that may ultimately have a personal consequence that is a direct or indirect effect of a decision or action, and no decisions should be made that will advance the personal benefits of a board or advisory committee member. Another value the board wanted to stress was confidentiality, and that is intended to protect confidential information that must remain confidential during and after board membership. Board discussions involving any of the following matters shall remain confidential unless the board expressly agrees to the contrary. 1, any discussion that occurs during executive session, and 2, any discussion concerning actual or potential litigation. Examples of times when confidential information can be discussed include executive sessions during open meetings or deliberations after a hearing. Now, most of you on the advisory committee will not be dealing with deliberations. Those are primarily for board members who serve on hearing panels if someone has been denied for licensure. The deliberations follow the conclusion of the public hearing. And if you're curious about executive sessions, basically that is a formal process where there will be an official vote for the board or advisory committee to enter into something called executive session. It'll be very clear if that ever happens, and we will guide you through that process. That is not public once the executive session has been opened. And so if we ever did that here, we would probably keep the YouTube running with a screen that said we'll be back at a certain time, and then we would go away to have the conversation confidentially on the phone or another format like that. And then when we're done, we'd come back, but the information discussed during that executive session would remain confidential. The expectations of board members document talks about the authority for the chair and vice chair. It says the chair of the board shall preside at all meetings, appoint members of the advisory committee, appoint members of the CRC, and appoint members of other ad hoc committees. The vice chair shall discharge the duties of the chair in his or her absence, resignation, or death. It also outlines the board executive director relationship. So in terms of the organizational structure, the executive director will communicate any personnel matters that should be addressed by the board to the chair of the board. The chair of the board will present these board related issues to the board, and the executive director will communicate to the staff the board's wishes, intentions, policies, etc. And I do that through staff meetings here at the BSRB office. Executive expectations. The executive director shall keep the board advised of BSRB activities by issuing a report to the board at each full board meeting, which summarizes pertinent information. The executive director shall prepare the agenda for board meetings in consultation with the board chair. The executive director shall prepare the agenda in consultation with the board chair for an annual board retreat, which shall allow for issues before the board that require in-depth consideration. And what we used to refer to as the annual board retreat, we now refer to as the out-of-town planning meeting that does move around the state every year. There's also language in that document as far as delegation to the executive director. The executive director shall be the administrative head of the organization, serving under the board at all times. The executive director is responsible for implementing and executing the policies and activities approved by the board. The executive director shall recommend policies and activities for consideration by the board and have sole authority to employ, eliminate, or fix the duties or salaries of other employees or independent contractors of the organization, subject to policies, regulations, and limitations approved by the state of Kansas. So while I do have the authority to hire individuals for the BSRB, we do need to have open positions for that. And then also anybody that I propose to be hired with a salary proposal that is reviewed by the Department of Administration as well as the governor's office. And the governor's office does have the authority to essentially veto any specific hire request that I might have or the specific amount of money. So there are some checks in place under the law. In terms of monitoring the executive director's performance, it says the board shall, when necessary, utilize executive session to discuss issues concerning the executive director, and the board shall formally evaluate the performance of the executive director each calendar year and on an annual basis thereafter, with emphasis on whether set outcomes are attained, which I think is a really good practice. It's always important to get good feedback, and so appreciate the board doing that and providing me feedback on different areas of my position. The second document you have in your pocket packet of material is the advisory committee policy. A fairly short document, it's just a little over 1 page, but it does outline the advisory committee purpose, which is to support the board in carrying out its mission to protect the public. And the process by which it does that is by addressing issues referred to by the board, or the advisory committees may suggest issues that believe the board should consider, referring them back to the board through the chair of the advisory committee. Once an issue is referred to the board has three options: address the issue at the board level, refer the issue back to the advisory committee for additional information, or not take any action on the issue. The structure of the advisory committee is that the chair of the advisory committee is a board member. A public board member will be an advisory committee. A public board member will be on the advisory committee, and there will be a minimum of 3 and a maximum of 10 additional advisory committee members. And most of the time, those individuals are licensees in the profession. The executive director is a non-voting ex officio member. The assistant director and licensing manager is encouraged to attend advisory committee meetings, and legal counsel representing the board should attend meetings when their attendance is requested. Concerning terms of advisory committee members officially serve 2-year terms, and advisory committee members are appointed by the chair of the board and can serve up to 8 terms. This is a recent change. So basically, the previous language said advisory committee members may serve up to 4 terms for a maximum length of service of 8 years. But the board had recent discussion about there may be former members of the advisory committee that would be interested in coming back and serving after a time. And the board modified the language of the policy and now allows there to be service on the advisory committee of 8 terms. But after your 4th term, you need to have at least a 2-year break. And then if you do have at least a 2-year gap in service, you're welcome to reapply to rejoin the advisory committee. And if that happens, you can serve the 4 additional terms. The policy states it is recommended that appointments to the advisory committee are staggered to avoid too many members reaching their maximum length of service at the same time. And then the really important language that is stressed there at the bottom. The policy does specifically say that the policies and procedures under which the BSRB board members are expected to operate will also apply to the advisory committee members. The policy talks a little bit about selection of advisory committee members. Nominations can be made by the public, committee members, members of a professional organization, or through self-nomination. Committees should ensure diverse representation, including geographic setting, gender, culture, ethnicity, and licensing levels. Members should represent both public and private sectors, as well as educators in the discipline. And when reviewing submissions, the committee will review the nominees' resumes, letters of interest, and their alignment with the board's mission and goals. And the committee chair will submit recommendations to the BSRB board chair for approval. Once appointed, the executive director will inform the new members of the advisory committee and may provide orientation to familiarize themselves with the board and the committee's roles and functions. And now I'll talk about a third handout that you have. It's a 1-page document, front and back. It talks about guidelines for attendees of meetings. So when we started broadcasting our meetings over the YouTube channel, there was a lot more visibility. And as you might imagine, that led to more questions from licensees, students, and other members of the public. We also had more individuals wanting to come to meetings and provide public comments. And so just to clarify that process and also clarify what was relevant for that, for these meetings, we put together this page modeled after what the legislature provides to their public attendees as well. It's an official policy posted on the BSRB website. One of the items in that document is it says that public comment is not entitled to individuals, but it may be approved at the discretion of the board chair or vice chair. And it does outline the process that should be followed for remote meetings and also in-person meetings, also during comments to the board or advisory committee, and it provides information on topics relevant for public comment. Now we're going to move into a section of the training that is more relevant for individual state agencies, not as specific to the work of the BSRB. So concerning professional licensing boards, Kansas regulates many professions through licensing boards or commissions created by the legislature to ensure professional competence and public safety. Boards are considered creatures of statute, which means the board's power is dependent on authorizing statutes. A board can only exercise authority granted explicitly or implicitly by the Kansas statutes, and boards cannot act beyond their statutory authority or in matters not addressed under the law. Boards must adhere to constitutional protections as well, such as equal protection, due process, and freedoms such as speech and privacy. Actions that are arbitrary, discriminatory, or violate certain rights, such as revoking a license based on a personal dislike, are prohibited. The Kansas legislature has control over certain aspects of licensing boards, such as modifying the enabling legislation, which would change the purpose of the board, limiting expenditures in an appropriations bill, or enacting new legislation to change the makeup, scope, or powers of the board. Concerning the functions and duties of licensing boards, one way to help understand some of this is that each licensing board has somewhat of an executive authority, judicial authority, and legislative authority. Under the executive authority, the agency follows the Kansas Open Meetings Act and also the Open Records Act, or COMA and CORA. Under the judicial authority, there's quasi-judicial hearings in reviewing facts when law violations have occurred. Or there's also the Kansas Administrative Procedures Act, CAPA, which we'll talk about a little bit later during the training. And then in terms of the legislative authority, the BSRB does have the ability to adopt regulations to implement or interpret statutes with more detail or specific requirements. And this process involves holding an open meeting on proposed regulations, allowing feedback, and there is oversight by a legislative committee. That committee is known as the Joint Committee on Administrative Rules and Regulations, or if you ever hear someone mention JCAR, that's what that committee refers to. Concerning statutes, regulations, and policies, regulatory boards protect the public by ensuring practitioners are competent and authorized to the implementation of enforcement of statutes, regulations, and internal policies. Board members must understand the differences between statutes, regulations, and policies to effectively carry out their duties. So statutes are laws passed by the Kansas legislature, signed by the governor, and derived from the Kansas Constitution. Most of the time when a bill is passed, the language will say that it will become effective upon quote unquote publication in the statute book, which is generally regarded as July 1st following the end of that legislative session. However, some bills may have another date. There may be a specific date where it will become effective on this date, or it may say upon publication in the Kansas Register, which is another type of publication that is a more frequent publication. So usually if it's published in the Kansas Register, it will become effective more quickly than publication in the statute book. Statutes also define the scope of the board's authority and override any conflicting regulations or policies. So if there is a regulation or policy and a bill is passed that conflicts with it, we follow the statute. The law trumps. And so that is something important to remember as well. And if a board requires additional authorities, such as investigative subpoena power, it must seek new legislation. Moving to regulations, those are rules adopted by a board to implement and enforce specific statutes. A board's authority to adopt regulations is derived from statutes. It is developed under the Rules and Regulations Filing Act and ensures that public and legislative input, consistency, and legal competence is provided. Regulations are helpful in filling out the details of statutes affecting the rights and responsibilities of third parties outside the board. And once adopted in accordance with the Rules and Regulations Filing Act, regulations have the force and effect of law and are legally enforceable. For a regulation to be valid, it must first fall within the board's statutory authority, 2, implement a specific statute, and 3, comply with legal requirements and constitutional standards. Regulations that exceed authority or conflict with statutes or the Constitution will be voided. And then moving to the third sort of item in the hierarchy of authority, policies and guidance documents. Policies may be adopted by the board only to guide its internal operations, such as prioritizing staff workload or explaining the investigative process. And guidance documents are documents that state a board's current approach to interpretation of law or general statements of policy that describe how and when the board will exercise discretionary functions. Sometimes you may see this actually in the minutes if the board has taken a position on how something should be interpreted as a standard function by the licensing agency. And so sometimes that is helpful in terms of the guidance that is provided through that. In terms of how to be effective as a board member and as an advisory committee member, it is recommended that you watch for conflicts. So be alert to agency policies or internal procedures that may conflict with statutes or regulations or may impact applicants or licensees. We do our best not to have policies that would conflict with those purposes, but we appreciate you all looking for those things. And if you ever have questions about something, please let us know. There may be a way that something could be worded more clearly, or there may be a specific reason why something is phrased a certain way. So if you do see a potential conflict, let us know. A way to be effective is to initiate action. If a statute or regulation are unclear or problematic, and we've talked about it, and that is something we need to fix, it's important that we take steps to amend them or propose changes. In terms of discipline, the purpose of discipline is to promote compliance and protect the public. Discipline should not be vindictive or disproportionate to the severity of violation. It's important to ensure that discipline is fair and proportional. Remember that the primary responsibility of the board is to protect the public, not to licensee. Concerning professional activities, board members may hold office in a professional or trade association, but cannot lobby for or vote on matters that affect both the association and their role on the board. Board members must not use their position to promote the interest of a professional association. Board members may attend professional conferences and social events, but must avoid discussing board business if there's a majority of members of the board, and we'll get into some of those specifics too. If a majority of the board is present, they must not discuss the business affairs or matters related to a particular pending application or a disciplinary matter. So it's really important to comply with the open meeting laws, and that is the Kansas Open Meeting Law, or COMA, and we'll get into some of the details about the COMA. Concerning conduct, a board member should not represent themselves as a spokesperson for the board unless specifically authorized by a vote of the board to do so. If unauthorized to give the board's position on an issue, members must clarify that any opinions are personal, not official positions by the board. Board members do not ask board staff or counsel to provide legal advice or preferential treatment to any applicant or licensee. Now, moving next to the COMA, we've referenced this at the beginning of every advisory committee meeting, but it's also really important that you understand some of the details related to the COMA or the Kansas Open Meetings Act. COMA ensures public access to governmental meetings to promote informed electorate. The purpose of this benefit is for the public, so COMA is interpreted liberally, and exceptions are applied narrowly to carry out its purpose. COMA applies to all state legislative and administrative bodies, as well as subordinate groups funded by public money. Subordinate groups are likely subject to the COMA if created or extended by a covered entity. So if you had a question about the advisory committees, yes, they do fall under COMA. COMA does not apply to quasi-judicial functions or proceedings under the Kansas Administrative Procedures Act, or CAPA. That does not apply to the judiciary, private organizations, or staff meetings of covered entities. The goal of COMA is to ensure transparency in government decision-making for the public. Meetings are defined as any gathering or assembly in person through the use of a telephone or any other medium for interactive communication by a majority of members of an agency or public body subject to COMA for the purpose of discussing the business or affairs of the public body or agency. And I went through that a little fast, so let me go back through that because there's really three major components that we have to be mindful of when it comes to COMA. So in terms of the COMA, a meeting is defined as any gathering or assembly in person through the use of a telephone or any other medium which involves interactive communication. That is one. Two, by a majority of membership of an agency or a public body subject to the COMA. And then three, for the purpose of discussing the business or affairs of the public body or agency. So if you have less than a majority of members of the advisory committee that want to have a phone call about something related to the advisory committee work, that is okay. As long as that stays just to a few members and it doesn't reach the majority of members, that would not constitute a meeting under the COMA. If you had a majority of members and there was interactive communication, if you made sure that you avoided any topics that were relevant to the work of the business or the affairs of the public body, so you avoided anything to do with the advisory committee, anything to do with the BSRB, you just went out to dinner, had a nice dinner, that's fine too. It can be a majority of members that are all together with interactive communication, but you need to refrain from the topic about what the group is actually involved in. And one of the other items too, it talks about communication that could be through telephone, in person, or medium of interactive communication. That involves email as well. So that is why we can't do a lot of work outside of these meetings where we're emailing things back and forth, and why you really need to be careful to try to avoid meeting any kind of violation of the COMA. So if it is something that would involve majority of members, if it would be interactive communication, and it would be about the work of the advisory committee, those do require public meetings. And so we'll go into a couple of the other items on here too. So It can include informal discussions before and after recesses of a public meeting, and all gatherings at any stage of the decision-making process. So it could be under a different title. If you want to call it a work session or a retreat, those are still open meetings, still subject to COMA. In terms of discussion, that does not require binding action or voting, and discussions can occur at a social gathering, retreat, or meetings held in private or educational conferences or seminars, and they also can occur when traveling to such meetings. So when traveling, members of the board should avoid discussing agency affairs or business if there are a majority of members present together. The presiding officer must provide a meeting notice, but can delegate this duty. So for the BSRB, what we do is we have a list of individuals who have requested notice. We send out notifications when those meetings are scheduled. We also post information to the BSRB website, which includes the date and time for the meetings, the format for the meeting, and then we also post the agenda and other meeting materials. Notice is not required to be published in a paper or on a website, but individuals must request it. And requests for notice can be verbal or written and are valid for 1 fiscal year. The notice must include the meeting date, time, and location provided in a reasonable time before the meeting. In terms of meeting procedures under the COMA, COMA does not require following Robert's Rules of Order or any other similar formal rules or procedures. COMA does not require the board create an agenda, but if one exists, it must be made available to the public. Meetings may be recorded if doing so is not disruptive, and the public does not have the right to speak. They do have the right to listen and observe, and secret ballots are not prohibited. So should there ever be a need for a vote, that would have to happen visibly, and you can't do secret ballots in an open meeting. In terms of the minutes, a board's policy may require minutes to be kept, but the COMA does not require minutes unless an executive session occurs. The motion to enter executive session must be included in the minutes. And under an executive session, it permits discussion of certain enumerated matters outside of public view. It cannot result in a binding action, but a consensus is allowed during the executive session, and any consensus reached must be formalized in an open session vote. Any kind of violations concerning COMA, those prosecutions are civil, not criminal, and any person, attorney general, county district attorney may bring an action in district court. The county district attorney or attorney general does have subpoena power, and enforcement actions take precedent over all other cases and are assigned for trial at the earliest practical date. Remedies for COMA violations include voiding any action taken if prosecuted by an attorney general or county district attorney, an injunction which would stop the action, a mandamus which would force the action, or a declaratory judgment. Penalties for COMA violations include a fine up to $500 that is assessed to board members for each violation. There can be an ousting from office, a recall from office, court costs assigned to the person seeking enforcement of COMA, or court costs assigned against a plaintiff if maintained action frivolously, not in good faith, or without reasonable basis in fact or law. Before we move on to the CORA, I'll just say this. We do take the COMA very seriously. We are very proactive in terms of putting out information in terms of the people who've requested it, but also on the agency website. We also have historically used something called the Kansas Public Square. So we try to also post information there as an additional step, but we do try to make the information available, and we also post the handouts and different information on our website. So when we're walking through this, we're mindful that people are watching the YouTube channel or may go back and do that. We want to make sure they have access to all of that as well. So we do follow those steps, but if you ever see that you think something might be missing, please let us know and we'll be happy to look into it. Moving next to another requirement for state agencies and committees under those agencies is the Kansas Open Record Act, or the CORA. Under the relevant statute, it mandates that public records must be open for inspection by any person unless otherwise provided, and CORA is designed liberally to promote such policy. For public agencies, it includes state, political, and taxing subdivisions, offices, officers, entities, etc., that receive public funds. And when not explicitly defined in the CORA, entities created or extended by a covered agency are typically subject to CORA. So you work on the BSRB Advisory Committee, it is under the Kansas Open Records Act. So we are subject to the CORA. In terms of public records, it includes any recorded information that is made, maintained, kept by, or is in the possession of any public agency. It does not include records that are owned by a private person or entity if they're not associated with a state agency or affected agency. CORA does not apply to private companies. even if publicly funded for services. It does not apply to judges and courts. It does not apply to individual legislature or governing body members or private individuals. Under the KORA, the board must appoint a Freedom of Information officer to assist with KORA requests, provide a brochure outlining requester rights, agency responsibilities, and procedures for inspecting and obtaining copies of records, and include contact details for the records custodian, fees, and office hours. And one of the first things, if you ever come into the BSRB office physically, you will see a document that is posted by our main reception area, and that is a copy of our brochure outlining rights under the KORA. And also on the BSRB website, under policies, there is a way to request records under a Kansas Open Records Act. So we do take into account these requirements and make sure we meet them currently and going forward. Anyone, regardless of residency, can request records. Individuals do not need to provide a written reason for requesting records. The board may require a request to be written with the requester's name, address, and proof of identification. The board may also require that requesters sign a written certification that the requester will not use names or addresses obtained from the records to solicit sales or services. And the board cannot deny a person the right to review records unless public records, unless closed by the law. If portions of a record are closed, the remainder must be made available to the requester, such as having a redaction of certain items in the record. Also under the KORA, the board is not required to make copies of the following unless shown at a public meeting: recording tapes or discs, videotapes or films, pictures, slides, graphics, or illustrations. Requests must be responded to within 3 business days with 3 possible responses. 1, the record is provided in the form requested if possible. 2, the request is under review and the records will be provided if permitted. Or 3, the request is denied with a detailed explanation for the denial. Public records must be released unless an exemption to disclosure applies, and the burden is on the board to provide exemptions. Exemptions can be discretionary or mandatory. Enforcement is Kansas is a civil. The KORA is a civil act, much as the COMA one was too. Any person, county district attorney, or attorney general may be bringing a civil prosecution. The county district attorney or attorney general does have subpoena power, and fines for violations of the KORA are similar to fines for violations of the COMA. Turning next to the CAPA, the Kansas Administrative Procedures Act. This establishes procedural rights and duties. It does not provide substantive law. Substantive law are governed by the board's Enabling and Licensing Act. It applies only when explicitly stated by other statutes, and it governs procedures for board decisions when specifically in the licensing or enabling statutes. So our statutes do need to govern when we're actually under the CAPA versus normally under the COMA. This ensures the board operates efficiently and in accordance with the law while balancing public access where appropriate. And licensing boards must conduct business under the COMA when the statutes direct decisions be made under CAPA. The board follows CAPA rather than COMA procedures, and CAPA and COMA are mutually exclusive. So I know we use those acronyms quite a bit. The general takeaway is that most of our actions here are under the Kansas Open Meetings Act. We provide notice, they're public. There are specific instances to where the board will move into a closed session under the Kansas Administrative Procedures Act, where there are certain types of meetings that are covered by the statute as under the CAPA, and those meetings are not public. The CAPA does set out a procedure to follow when the board is deciding what to do in cases involving an individual licensee. And in these cases, the board conducts a quasi-judicial function in deciding the outcome of the case. It does not require public notification for licensure application reviews or CRC meetings, including probable cause determinations and summary orders. Only hearings need to be open to the public under CAPA. So if there is a decision by the board and that is sent to the individual will have the ability to request a hearing or an appeal, and that hearing or appeal is a public process. But the initial discussion by the board members happens under CAPA, and that is closed. Decisions are made upon issuance of a license or order. Public voting is not required, and during CAPA proceedings, relevant board staff or legal counsel may attend to provide necessary information and legal advice to board members. Board activities that are not covered by CAPA and must be acted upon in an open meeting include things like approving board minutes, deciding whether to renew contracts, delegating authority to the board members or executive directors, discussion and votes to approve or amend regulations or guidance documents, policy decisions affecting the way the board operates, or reviewing agency updates such as things like the budget, legislation, etc. And I think most of this is trying to say the majority of work that you're going to see from the board is going to be done publicly under the COMA. But when you have something where there needs to be some discretion, such as looking at an individual licensed applicant or looking at a complaint filed against a person, those are under the CAPA specifically in the statutes, and that's why they're in a closed session. Another time that the CAPA would apply is for applications for licensure, and in those situations, applicants have the burden of proof. The staff will collect the necessary information for the board to assess whether the applicant qualifies for licensure or if conditions or restrictions apply. And if the board conditions, denies, or restricts the license, the applicant may request a hearing unless agreed to in a consent or order. And then under the investigation, the board has the burden of proof to show a licensee has violated statutes or regulations. Licensing boards can investigate complaints with the investigator presenting findings to the CRC. The CRC determines if there is a probable cause to believe a violation has occurred on reasonable grounds, and then reasonable grounds are basically explained there. Also, the CRC must ensure the licensee's conduct that they are accused of actually violates one of the board's statutes or regulations. It's not enough that you made someone angry, it's actually going towards the statutes or regulations and whether they were violated. And licensees can request a hearing within a certain amount of time. And once a petition or request for hearing is filed, the CAPA guides the proceedings and the hearing. In cases where there's an immediate danger to public health, safety, or welfare, the CRC may suspend a license without giving licensing notice or opportunity for a hearing, but then later on there will be an opportunity for an appeal of an emergency order at the district court. And then the last item I'll talk about during the training before we wrap up is the Kansas Tort Claims Act. This has not come up during the 4 years I've been with the board, but I do feel it's important to stress this. Under the Kansas Tort Claims Act, it governs liability of the state of Kansas and its agencies and employees, including board members, elected appointed officials, or others acting on behalf of the government. It establishes various liability for wrongful acts or omissions in the scope of your employment with potential case-by-case immunity. So if you are ever sued for something based on your work as a board member or advisory committee member, the state will defend you at no cost as long as you meet certain standards. And one, you really need to act timely on this. So if you are notified you're being sued as an advisory committee member because of your work on the advisory committee, you need to submit a request for representation within 15 days and then cooperate in your defense. And the state may choose not to defend you if you acted as actual fraud or malice, fail to make a timely request for representation, or the judgment is for an act or omission that occurred outside the scope of your duties as a board member or advisory committee member. So just in conclusion, recommend that you become familiar with the statutes and regulations for the profession, review the policy documents, including the 3 that were mentioned in the training, become familiar with the BSRB website and other resources available to you, try to uphold the values the board members and advisory committee members are asked to uphold, and then be mindful of the laws, including things such as the COMA, the CORA, and the CAPA. And with that, I'll go ahead and end the training, and I'll see if there's any brief questions before we end the advisory committee meeting today.
Thank you for that, David. There's always a lot of information to go over. Are there any questions that stood out?
I don't really have a question. It's just interesting to me that there are more counselors and more about the same MFTs as there are psychologists, and yet they have 2 representatives on the board. I know the history of that, and it's just the representation thing is just intriguing to me.
Yeah, and I think that was because originally it was taking the 2 groups, putting them together. So there were social workers and psychologists, and then as the other professions join, there's just one. But it's also important to note the BSRB is not an advocacy board, so it's really about having at least a representative from each profession, as of right now, to be able to talk to the uniqueness of it. So,
I hear you.
But it's noted. Yeah.
Okay, well, I appreciate everyone's time today. I know that's a lot to get through and we're at time. So just reminding everyone, our next meeting is February 14th, it looks like. So we'll be together for Valentine's Day. To reiterate David's comments earlier, I just want to thank all of you for your service and commitment to the advisory committee. It is really important work that we do, and there's been a lot of valuable input and changes made to and recommendations to the board. So I just appreciate all of the work you do, and I'm hopeful that everyone has a happy holiday season and stay safe. With that, I'll take a motion to adjourn, please.
So moved.
Thank you, Chris. All those in favor, please say aye.
I
Aye. Thank you all very much. We will see you soon.
Bye.
Thanks, everyone.